and then figure out how to compensate for that and figure out how to compensate for that, which is why most PT corrective exercises fail and actually increase symptoms, which is also why most patients who go to conventional physical therapy that are given a home exercise program that is stretching and exercise get worse. They're non-compliant with their exercise program because they're stretching, which causes more inhibition. Then they're trying to go through ranges of motion with resistance that they can't because they have inhibition, which causes them to compensate more, which gives them more pain and more tightness, which is why they don't want to do their home exercise program. So if you're giving people home exercise programs that are increasing their symptoms or making them stiffer long-term, they're not going to do that. So if they're non-compliant, look at your home exercise program and figure out, did you get to the root cause or did you just throw corrective exercises at them, which is making them worse? All right. So I gave her certain things to work on at home. Those turn into her active dynamic warm-up before practice, after practice. So when she left, she still had this look on her face, well, I still have some pain, which means you didn't fix the problem. I still had pain when I left the last guy. I said, trust me, in 2 hours from now, I want you to redo these exercises, redo those little tests that I gave you, and that should feel better. So here's the difference between conventional physical therapy and 180. Conventional physical therapy, you feel great leaving the clinic because they manipulated symptoms, but then you feel worse an hour or two later, and then you got to go back and manipulate symptoms again. Here, you might still have some pain, some tightness, some rigidity, swelling, whatever when you leave, but an hour later, 2 hours later, the next day, it should be better.